I'm Kath Williams. I'm the programme leader for the BA in Health and Social Care at the University of Derby. My professional background is social work, and I've worked with children and adults with a range of complex health and care needs for about 15 years, really, before I moved into education. So I've worked in the community, I've worked in hospital settings, and done a range of different sort of roles and tasks, you know, as a worker supporting vulnerable people. I think the world is gaining, you know, awareness. I think we're seeing an understanding dementia not just as an individual disease that affects people that we may or may not know, but actually a national and an international condition where we need to work together to get the best possible sort of research and practice, treatments. You know, it's something that affects, like cancer in a sense, it affects, you know, people globally. It doesn't distinguish, you know, in terms of, you know, where people live and socioeconomic backgrounds or anything like that. So the response has to be global. We have to move away from, you know, a localised way of thinking. We need best practice, and that can only be achieved kind of across the, you know, across the globe internationally. Who owns the problem of dementia? And, you know, on one level it's a simple answer. You know, the person with dementia owns the you know, it's their experience, and their experience is unique and individual to them. So in lots of ways they set and need to set the agenda for what's right for them, because what's right for them might not be right for somebody else. And that's the danger with organisations and professionals setting the tone or the leader, you know, leading on it, because it becomes service-led. It becomes their understanding. They're imposed to an extent on to that individual, that person's experience. So I would have a problem with that. At the same time, yes, we need leadership. We need you know, whether you call them dementia champions or whatever. We're catching up really with what's been for many years very poor care, very poor understanding, and a lack of training and expertise and knowledge around dementia, and that is changing quite rightly. And you know, we're moving. People are becoming more, you know, knowledgeable, more having more expertise, getting the depth of knowledge and understanding that they need. And we're seeing services develop that are specialist. So we need those. We need that, and we need the leadership, you know, both within the specialist charity sector and within government. Because fundamentally, yes, a lot of the resources are there, and the strategies and the guidance, best practice, they're the ones that are going to be funding research and funding best practice that can help inform delivery of services that work. Because, you know, in the environment that we're in, we need evidence-based interventions. We need to know that what we're delivering and offering and providing works and has good outcomes. Even, you know, not necessarily towards the cure, but to whether it's slowing down the progression of the disease, whether it's enabling a good range of care choices for the person, and you know, and even at the end of life kind of care as well. That there's been lots of areas of neglect, you know, where we haven't really understood what was needed. People with dementia have long-term conditions alongside that. They may have dementia, but they also have maybe other conditions as well. So there's complexity at times which can be missed and misdiagnosed when they're entering care, hospital care and A&E and services like that, where people see the dementia or don't see the dementia and actually treat the condition, and the fact that they're confused and disorientated and very stressed is kind of missed and ignored, and what the relatives are saying ignored. So we've got some very poor examples of the lack of training and understanding that where we need leadership, we need good guidance, we need better training. We're getting there. We are moving, in the right direction. I think the reality is, whether you live in the West, in countries like the UK where there's a great National Health Service, or whether you live in a developing country where there isn't a welfare state, or even in America where you have to pay for care, the bulk of care is provided by families and carers. They provide most of the care and most of the support most of the time, and that's probably the way it needs to continue to be. I think most of the time people with dementia want to be looked after by people they know and trust, and that's their families and carers. And most of the time the carers feel the same. Whether it's a role for wider society, for government, for policy and leadership, is in understanding there is, for example, an economic impact for the person with dementia and their carers as the disease progresses and their ability to function consistently and effectively changes and deteriorates. Perhaps they have got to give up work. And the carers will be, more involved and picking up some of the economic, financial, loss of income. And that may be something that, again, the West, Western societies, the richer countries, should be. We have a system and a welfare system. We have, employment legislation. We have carers legislation. We have a lot of policies and leadership and sort of, that should be there to help support the change of circumstances. And we have a great charitable sector as well. I don't want to forget about them, because, again, the charity sector, the voluntary sector, pick up a lot of what the statutory sector are not able to provide. And we know, for example, with the Care Act, the new Care Act, that increasingly care is personalised. People are paying for their own, towards their own care, directing their own care, in consultation, in partnership, with professional care as well as their families. So we've got a complex, kind of a complex picture. But I think we also know that the statutory sector, in terms of budgets, in terms of funding, is shrinking. It hasn't got the funding. So their support is likely to be targeted, it's likely to be restricted to and limited to those at the acute end and those with the highest care needs. So that leaves a lot of people out there who are still in a position where they're managing their own care and want to be in control of that, but need, support, information and so on. So I think the role of carers is going to become even more important. Their needs, their needs for information, their needs for support, and I think they're going to need to play, as big a role as they can, alongside the person themselves, in directing the ways that dementia is supported in the future.